Okay, number 6 sitting, right?
Vertex.
Have you ever experienced your heart starts to beat really fast, or the palms of your hands start to get really sweaty, and you feel those icky butterflies in your stomach?
Yes. Yes.
Chances are you probably have at some point. Many people, including myself, have all experienced some kind of anxiety. The
Yes.
Anxiety and Depression Association explains how anxiety disorders are the most common kind of mental illness. And anxiety disorders affect more than 40 million adults each year. Even though anxiety is really common, there are still many people who don't fully understand what anxiety is. So today I'm going to talk about that. I'm going to teach you what anxiety is, the different kinds of symptoms people experience, the different causes, and the different treatment options. So let's begin with what anxiety is.
Yes.
The National Institute of Mental Health explains that everybody experiences some form of anxiety at some point in their life. Whether you're anxious about an upcoming test at school, dealing with problems at work, or you're about to make an important decision. Occasionally feeling anxious is completely normal and is actually expected, but anxiety turns into an anxiety disorder when it's not just a once in a while feeling. It's when your anxiety happens all the time, it's reoccurring, and it doesn't just stop or go away. And that's a big problem because if your anxiety keeps happening, then it can eventually turn worse. The American Psychiatric Association tells us that there are 5 different types of anxiety disorders. Generalized anxiety disorder is an excessive worry about several different things in one's everyday life. These things can be big things or they can be little things. Panic disorder is somebody who gets frequent panic attacks, and these panic attacks can be so extreme and severe that people might actually go to the emergency room because they feel like they're having a heart attack or a life-threatening illness. So social anxiety is the most common kind of anxiety disorder, and it starts to affect people around the age of 13. People who have social anxiety feel excessively anxious in social situations that they're going to get rejected or humiliated. Phobias or specific phobias are an excessive fear of a specific thing, object, or activity. And the last thing is separation anxiety. Separation anxiety is the fear of being separated from the person that they are attracted to. There are many different symptoms that people experience from anxiety, and there are also specific symptoms for each type of anxiety disorder. Also, no 2 people are alike, so 2 different people can experience 2 different kinds of symptoms. But the Mayo Clinic explains some of the more general types of symptoms that people have. So things like an increased heart rate, hyperventilation, sweating, and excessive worry are all common symptoms that people may have with anxiety. So now that I've talked about what anxiety is and some of the symptoms, let's move on and discuss what causes anxiety. Anxiety disorders are still really complex, so doctors don't fully understand anxiety disorders or what causes them. But things like traumatic events, certain personality types, and genetic factors can all contribute to why a person may have an anxiety disorder. There are also certain medical illnesses that are linked to anxiety disorders. There are also certain factors that may increase a person's risk to developing an anxiety disorder. These can stem from excessive stress buildup, stressing about an illness, caffeine intake, and drug and alcohol can all increase your chances of getting an anxiety disorder. So now let's move on to the different kinds of treatment options. The good news is, if you suffer from an anxiety disorder, it is treatable. And there are several different ways. The first step is to get properly diagnosed from a healthcare professional so that you can figure out and get treated for your specific needs. There are also many different approaches to treating anxiety disorders, but the American Psychology Association explains how seeing a psychologist is a really effective way to treat your anxiety because psychologists are highly qualified and trained to help people and teach them healthier and more effective ways to cope with their anxiety and how to learn to identify and manage your anxiety. And that's really helpful because if you understand the different triggers that cause your anxiety and can manage how to stop them, you can fix your anxiety to reduce the amount of times that you feel anxious. There are also many different kinds of medications that are effective to treating anxiety disorders. But the problem with having so many different kinds of medicines is that it takes a lot of time and patience to find the specific medicine that works best for you and your needs. There are also different natural ways to reduce your anxiety, things like meditation, exercising, healthy eating habits, and yoga are all really important and helpful. By now you should understand how real and prevalent anxiety is and have a more general idea of what anxiety is, all the different types of symptoms that people might experience, some of the causes, and all the different treatment options. If you suffer from anxiety, just know that you're not alone and that there is help available. Thank you for listening to my speech. Okay. Have any of you guys ever felt your heart start to beat really fast or the palms of your hands start to get really sweaty and you get those icky butterflies in your stomach when you're nervous? Chances are you probably have. Many people, including myself, have experienced some kind of anxiety. Anxiety is so common that the Anxiety and Depression Association say that anxiety disorders are the most common mental illness, and anxiety disorders affect more than 40 million adults per year. Even though anxiety is still really common, there's so many people that don't really understand it. So today I'm going to discuss what anxiety is, the symptoms that some people have, what causes it, and the different treatments for it. So let's begin with what anxiety is. The National Institution of Mental Health says that everybody experiences some form of anxiety at some point in their life, whether it's getting nervous about an upcoming exam for school, dealing with problems at work, or getting ready to make an important life decision. Occasionally feeling anxious is normal and expected, but anxiety turns into an anxiety disorder whenever it's not a once in a while feeling of being anxious. An anxiety disorder means you have anxiety very frequently, it's reoccurring, and it doesn't stop or go away. That can become a problem because if it doesn't stop and prolongs, it can become worse. The American Psychiatric Association says that there are 5 different types of anxiety disorders. General anxiety disorder is an excessive worry about several different things that occur in people's everyday lives. These can range from big things to little things. Panic disorder is reoccurring panic attacks, and sometimes the panic attacks that people experience are so severe that they'll go to the emergency room because they believe they're having a heart attack or a life-threatening illness because they're so intense. Social anxiety is the most common form of an anxiety disorder and usually starts in people around the age of 13. A social anxiety person feels like they will be rejected or humiliated when they are in social activities. Phobias or specific phobias are an excessive fear of specific things, objects, or activities. And lastly, separation anxiety, which is an excessive fear of being separated from that person that you are attached to. There's so many different symptoms that people can experience, and not every two people are the same. So what somebody experiences could be different from what somebody else experiences, and each type of anxiety disorder has their own symptoms that people feel within those different disorders. But the Mayo Clinic lists a general idea of what the most common symptoms are, which are an increased heart rate, hyperventilation, sweating, and excess worry. So now that I've talked about what anxiety is and some of the symptoms, let's talk about what causes it. Anxiety is still really complex, and many doctors don't fully know what causes it. But things like traumatic life events, certain personality types, and genetic factors can all be causes. There are also some medical illnesses that are linked to anxiety disorders. There are also certain factors that can increase your risk to develop anxiety disorders. This is like stress buildup, stress from an illness, your caffeine intake, and drug and alcohol can all increase your chances. So now let's talk about the different kinds of treatments. If you suffer from anxiety, don't worry because it is treatable. The first step is properly getting diagnosed by a healthcare professional so that you can be properly treated for your specific needs. There are many different approaches to treating anxiety. The American Psychology Association says that seeing a psychologist is an effective way of treatment because psychologists are trained to diagnose different anxiety disorders, and they can teach the patient healthier and more effective ways to cope with their anxiety. Also, learning to identify and manage your anxiety is effective, so that way you can learn what triggers your anxiety and how you can prevent yourself from becoming anxious in the first place. Medication is also an effective treatment to anxiety, but there are so many different kinds of medication that it can take a lot of time and patience to find the medicine that works for you. There are also different natural ways to reduce your anxiety. These things can include meditation, exercise, healthy eating habits, and yoga, etc. Anxiety is very real and really prevalent. By now, you should understand what anxiety is, understand some of the symptoms that it can cause people, why people get certain anxiety disorders, and the different kinds of treatments available. Thank you for listening to my speech, and if you suffer from anxiety, know that you are not alone and there is help available.
Where? How?